Well, they aren't new, but the messaging has changed a bit on a few Toledo-Lucas County Health Department billboards around town. You may have seen them. Donna Fox is with us this afternoon from the Health Department. Donna, what exactly are these billboards all about?
We just need to keep pushing the issue that syphilis is serious. It can bring lifelong infection in the body, but it's curable and it's treatable. But people need to prevent syphilis as much as possible. And by working as a community, we really appreciate the opportunity for people to all be influencers.
You know, I've been driving around town and seeing the billboards, attention grabbing. You know, obviously that's what you're trying to do. The latest one here, we have some video of it, and it says syphilis is a hookup you'll never forget. So trying to be clever here, trying to catch some attention. This is the latest in a series you've done, you know, similarly like this. How has that campaign been going?
The campaign is going well because we're reaching the community. They're talking about it. It's an interesting campaign. And the message before this, syphilis is serious, is the bottom line to syphilis and why we have to address it as a community. And just encourage people to wear condoms, protect themselves, and be cautious when they have anonymous partners.
You know, it's as simple as that, you know, preventing wearing a condom. It's as simple as that. But there's a reason why these billboards needed to go up, and we needed to get some attention to this because the data here is showing that these cases are on the rise, aren't they?
They are on the rise, and despite the conversations we're having in the community, which we so appreciate, we're still up 44% over last year.
Wow.
So far, year to date.
Right.
So it's a big deal. Now, 20%, 19% since 2018, which is statewide data, but still, this is or local data, because our data reflects an 8-county region. So our area of responsibility is all of Northwest Ohio.
Sure. You know, so is it maybe unclear, maybe you're getting the attention and more people are getting tested and more people are getting positives? It's unclear.
Well, no, that's exactly a great point, because encouraging people to come in and get tested, we can treat for syphilis. It's an antibiotic. We can treat for syphilis. People can be cured of it, and it will go away. Now, the problem is if your symptoms go away, which they can, your symptoms will go away, but the infection will stay in your body. And that's a problem, because that's when it leads to more long-term consequences of ocular syphilis, brain syphilis, like serious health consequences if you don't get treated. But you can be treated, and that's a great thing.
Yeah, because, you know, some STIs aren't, you know, treatable, or, you know, you'll have them or they can't be cured. So that's the word I'm looking for. They can't be cured. So in this case, it's, you know, you can treat this.
You can treat this, but you also can prevent it. So we
want to do that.
We want to do that. But people also need to know syphilis has to be tested using blood.
Okay.
So if you go into your physician and say, test me for everything, if they don't do a blood sample, you are not getting tested for syphilis. So it's really important that people understand blood must be used to be tested for syphilis. That's really critical information to know. So that's really where we need to go for that. But if you have syphilis and your symptoms go away, the infection is still in your body, and it's going to lead to long-term consequences. So we encourage people to get tested if you're at risk now, or if you've been at risk previously. Make sure that you've been tested for syphilis.
You know, is there you said it stays in the body. Is there a potential for maybe a pregnant mother to pass that along to a baby? Is that
That's
possible
exactly accurate. It's called congenital syphilis. So when your first prenatal appointment, you will be tested for syphilis. That's a CDC recommendation. But you also should be tested between 28 and 32 weeks to make sure that maybe you weren't re-exposed, and make sure that the infection was fully treated. So that prevents the baby from getting syphilis. If the baby's born with syphilis and wasn't treated, the baby can be born stillborn. They can be born with birth defects. So again,
it's serious, as you said.
Syphilis is serious.
It is serious, and we see these cases go up. So this is something that we want to get the word out about. Can people get resources through the health department?
There are lots of resources. That we have a wonderful judgmental-free clinic at the health department with great staff. Our website itself, lucascountyhealth.com, has a great number of resources. And if you go to your medical provider and say, test me for everything, make sure that your blood's being tested as well.
Great tips here for people to just keep in mind and keep an eye out for those billboards too.
Thank you.
Thank you for being here today. We appreciate it.